If you work in health IT, you've likely heard the term clinical pathway come up in some meetings and discussions that you've had. And depending on what team you're on, you may or may not fully understand what that actually means and how it fits into EHR config. So in today's video, I want to talk about what clinical pathways are, how they show up in the EHR, and why understanding them helps clinical, technical, and operational teams collaborate more effectively. So let's start with what they are. A clinical pathway is an evidence-based, structured approach to managing patients with a specific condition or within a specific clinical scenario. The goal is to decrease unnecessary variations in care delivery, because even when the evidence is clear on how the condition should be treated, there can be differences in how clinicians, units, or facilities deliver that care. So pathways are a mechanism for looking to close that gap and aim for more consistency. They're put in place to help standardize best practice, to improve patient outcomes, and to potentially reduce the cost of delivering the care. Pathways are a little different than protocols because protocols will typically tell clinicians what to do in a very specific, often time-bound situation. And a pathway involves a more comprehensive part of that patient journey and really looks to define, optimize, and sequence all the tasks along the way. Clinical pathways can also cross departments and care settings, so inpatient and outpatient if they need to. So some of the more common examples you might come across would be acute stroke care, sepsis management, hip and knee replacements, cancer care pathways, perhaps some post-op surgical care paths, things like that. When you think of something that has to document every step along the way in a complex sort of multi-day clinical scenario, you might be thinking of a bunch of PDF documents sort of listing step by step on a repository somewhere, or perhaps a binder that would outline everything. But in reality, a lot of organizations have chosen to take specific pathways and build them right into their EHR functionality, so you can actually leverage and start to see the benefits of having that system support underneath you. So you can see supports built into things like order sets, clinical documentation, dashboards and reporting, alerts and best practice advisories, task lists, some of your consult and referral workflows, and really all over the functionality within one of your core EHRs. For example, if we look at the sepsis pathway, you may see specific pre-populated labs or antibiotics in an order set, best practice alerts that are prompting clinicians to take specific actions at a specific time, documentation prompts in structured notes or assessments that relate to pathway progression, vital sign monitoring workflows, and sepsis dashboards to make it easier to see where a patient sits in their treatment path and how things are going at a glance. One of the most important things to note is that clinical pathways will naturally cross roles, departments, and functional areas, which means that pathway-related work is often one of the areas where silos either improve or become much more visible. In order to set up and maintain a single pathway, you may need input from physicians, nursing, pharmacy, allied health, registration staff, clinical application teams, interface analysts, report writers, and hospital administrators. With all those interested parties, it becomes easy to see how pathway-related work can become very complex. When a request for a new build item or changes to something that is already live in the system come through, it's important to understand whether or not that is tied to a clinical pathway, because if you look at that just in the single context of the module that it's requested, without realizing that it's actually connected into one of these broader patient care journeys, you can inadvertently break something that was never anticipated to occur. So it may not even be in the context of the request that's coming in, but if it's a shared observation, for example, that is going to be altered in some way, and the people that are working on the clinical pathway or aware of the clinical pathway and the config that's in that don't realize that it's been changed, or report writing doesn't recognize that something has shifted, then you may find unanticipated consequences that way. So collaboration in these areas becomes very important as an IT analyst. Once you have a clinical pathway that's set up and is configured in all the different modules and various areas within the EHRs and systems that it needs to be set up in, and it's been taught operationally and it is in use, it's worth remembering that it's not going to stay static. Evidence changes and clinical practice evolves. Organizations may have different priorities that they want to focus on. And of course, vendor partners are consistently coming to the table with new and improved functionality as they go through their release cycles. So for health IT professionals, that means that once clinical pathways are in place, it's not just regular maintenance that you're looking at. They're often reassessed and tweaked and improved upon over time and continue to evolve as you go through things. They may also have additional elements that are added in, and they may be connected to other pathways that you've created along the way. At the end of the day, they're really just one example of the great way that technology can support care delivery. And I want you to take away from this the fact that they might be connected to a lot more things than you first initially realized. And when someone mentions clinical pathways in some of the discussions that you're having, that you start to think, oh, wait a second, I might need to talk to more people. I may need to make sure I fully understand how this is connected and where it's connected. So in my regular day-to-day work, I'm not having an unanticipated impact. That's all I have for today, and I will see you again next time.